It's certainly disturbing how quickly this situation's moving with COVID-19. There are signs of spreading and community level within the United States, which will be of great practical macro concern as well. Let's catch up now with an epidemiologist. In fact, epidemiologists have had more airtime than probably any other category of expert because of the nature of the job and trying to estimate where we're heading with this outbreak and try to make sense of the numbers we have so far. Let's welcome Dr. Eric Feigl-Ding from Harvard Chan School of Public Health. Thank you very much for taking the time.
Thank you. Happy to be here.
In our minds, I'm sure many of us have these worst-case scenarios that we've read about. For example, from Harvard epidemiology professor Mark Lipset's prediction that 40 to 70% of the global population will be infected with this COVID-19 infection within the coming year. Is that number still based on what we're seeing? Has it changed since then?
Yeah.
What do you think?
He's a little dramatic, but there is an air of likelihood that could happen. That's not the 95% certainty. I would say at least 1 in 4, 1 in 3 is definitely of the world population, and I think it's adults, so not all numbers. It seems children are not as affected. They could be infected, but they don't seem to be at a tremendous risk, which is good in many ways. But it spreads so easily because it has asymptomatic infection. So we might have some antiviral drugs to slow it down in 6 to 9 months, but those are not here yet. The only thing we have available as countermeasures is quarantine and social distancing. And quarantine does not work well anymore, unlike SARS, where we defeated SARS without a vaccine. We are not able to defeat this without a vaccine, I'm pretty sure, because asymptomatic transmission means someone can be spreading it completely oblivious to the fact that they have it for several weeks. So this is why this virus has an R naught, which is a reproductive number of between 2 and 4, which means for every infected person, that person will infect 2 to 4 additional people. And compare that with the flu. The seasonal flu only has a 1.3. So this is, if not 2 times or 3 times faster in transmission. And severity is also pretty severe because 20% of the people have severe cases. And of those, like a half or a quarter of them need an ICU care. Those are very, very taxing things. There are stories in China in which people are in the ICU for 4 weeks on ventilators. And many countries in the world do not have ICUs, enough hospital beds, or enough ventilator machines. So this is going to be very, very problematic on the global scale.
I'd love to do a comparison between the US and South Korea right now. I mean, we're actually just being told that Vice President Mike Pence said all those coming to the US from Korea and Italy will undergo medical tests within 12 hours of their arrival. But there have been concerns about US test kits maybe not being particularly accurate and the speed at which tests can be carried out. What's your view on the US situation, first of all?
Korea has set the stage in terms of the gold standard for testing. Korea has almost 100,000 tests done. America has only done barely 1,000, and America is many folds larger than Korea. And we're seeing deaths immediately already, which means the fact that we're seeing deaths, we're behind by 2 or 3 weeks in terms of testing. So there's been an open epidemic in the United States for at least 2 or 3 weeks, if not longer. It is just terrible in the United States. We're literally driving in the dark with no headlights at midnight. In many ways, I'm really worried about the United States because I think the United States will have a worse outbreak than many countries because we do not have universal health care. And that will show up in the mortality and severity as well.
So speaking of mortality, and again, coming back to South Korea being the gold standard, as you described before, for testing, with our mortality rate being relatively low at the moment for what we can tell, and there's always a big asterisk next to that, given that we don't know exactly how this is going to play out. How important is early diagnosis, would you suggest at this point?
Early diagnosis is critical because early diagnosis means that's how we lock down. This is how an epidemic normally is controlled. We diagnose early, we lock down the cases, we trace who they were exposed to, and we quarantine who they were exposed to. And literally, early diagnosis means stopping transmission of hundreds, if not thousands, of additional cases. This virus has a doubling time of 1 week. So uncontrolled, 100 will become 200, will become 400, will become 800, 1 week at a time. And so this is why early diagnosis is literally critical. You can cut the epidemic in half.
Dr. Eric Feigl-Ding from Harvard Chan School of Public Health, it's been great to connect with you.
Yeah, thank you so much.
Thank you. This Morning continues very shortly.